Hi there, this is Amelia Heart and Vascular Center, and today we're going to talk about aortic valve regurgitation. This is a condition where the heart's aortic valve does not fully close, which results in oxygen-rich blood leaking back into the heart instead of being pumped into other areas of the body. This will result in the heart inefficiently pumping blood in vital organs to not get enough oxygen. As you can see here, I drew the aortic valve, the aorta, and other basic parts of the heart, and this is what a normal heart should look like, while those with aortic valve regurgitation will have leakiness in the aortic valve. And here I'm drawing the aorta again and the left side of the heart, and here the valve does not close all the way, causing blood to leak back toward the heart. Now I'm going to draw a close-up of what aortic valve regurgitation looks like. Here I'm drawing the heart structure again, the left and the right side of the heart, and the aortic valve is on the left side of the heart. Here you can see the blood coming back toward the heart instead of pumping out into the body. Now you can see what a normal valve looks like. It closes tightly and fully covers the aorta to prevent blood from coming back. In regurgitation, though, the valve does not close properly and thus causes leakage. The blood is then able to leak back into the left ventricle as opposed to going through the aorta into other parts of the body. Now that we know what aortic valve regurgitation is, what are the causes? The first is rheumatic fever. If you had a complication of strep throat as a child or as an adult, this can cause the valve to be affected. If you have this particular disease, it's called rheumatic heart disease. The second is endocarditis. Endocarditis is a damaged valve caused by bacterial growth, and in this case, it'd be the aortic valve with bacterial growth. The last cause is heart valve disease, where you may have been born with it, or over time, because of the aging process, developed aortic valve regurgitation. There are also other ways that this can occur, such as rare conditions like Marfan's or trauma to the chest, but usually these are the causes. In terms of symptoms, aortic valve regurgitation develops gradually, so it's common not to see symptoms for years. As the condition worsens, a patient may experience fatigue and weakness, shortness of breath, which they may experience while going up a flight of stairs or a hill. They may experience episodes of chest pain. They may have been told by a doctor that they have a heart murmur. They may experience fluttering heartbeats, or they may experience an irregular pulse. Now, how do we confirm the diagnosis of aortic valve regurgitation? There are many ways for the doctor to diagnose this, but the most common way is usually the echocardiogram. The echo takes pictures of your heart and valves, and it allows the provider to see any irregularities in your valve and whether or not the blood flow is returning back through the aortic valve. A chest x-ray can possibly reveal an enlarged heart and start the process of seeing whether there is an irregular valve, but you cannot confirm aortic valve regurgitation with this. In addition, an EKG may show hints of aortic valve regurgitation because it could show that possibly your heart chambers are enlarged, which can be due to a valve issue. You would have to confirm it with an echo, though. Additionally, a stress test can help a provider see your stamina and physical activity, which can determine the severity of valve disease. You may have aortic valve regurgitation to the point where it prevents you from performing rigorous exercise. This cannot diagnose the condition, but help us understand your exercise tolerance. And lastly, a cardiac catheterization can be performed, where a catheter is placed through your arteries and up to your heart to look closely at your heart valves, chambers, and the pressures within. Now, you may think, okay, I have aortic valve regurgitation. What are the treatments? Some people never need treatment for aortic valve regurgitation, and they just require monitoring of symptoms and routine echoes until they pass away. Others may require a repair. An aortic valve repair, though, can be difficult to do and sometimes is harder than the actual replacement. So oftentimes, if your aortic valve disease is severe and causing you symptoms like shortness of breath or chest pain, you may have a replacement of your aortic valve. They may place a mechanical one or a valve from a pig, cow, or human tissue. This can be done through minimally invasive procedures or an open surgical repair, depending on the patient's condition. Lastly, let's talk about living with aortic valve regurgitation. What can you do to help yourself? You can eat healthy, you can regularly exercise, you can keep yourself at a healthy weight, quit smoking, get your flu shot yearly, and moderate alcohol. Thank you so much for watching. I hope you understand a little more about aortic valve regurgitation. This is Amelia Heart and Vascular Center, and go ahead and look at our website for other patient educational videos and blogs. Thank you.